The following is a paid program by Pitt Community College. Welcome to Education on Call, the program that gives you free information about new career opportunities from Pitt Community College. Now here's your host, Mike Weeks. Thank you so much for joining us for this latest edition of Education on Call. Over the next half hour, we'll be answering a lot of questions you may have about career opportunities that result in high-paying jobs. Now, whether you've recently lost a job, perhaps due to a plant closure or a business closing, perhaps you went to work right out of high school and you've been working several years and now you want to train for a new, higher-paying career. Or if you're a high school student or the parent of a high school student looking for college opportunities, you're going to want to stay tuned. We've got a great show today. And if any time during the program you'd like to request more information about the college, a program we've talked about, or a topic, you'd like to contact one of our guests, you can do that too. It's very easy. Text the word PITTCC, PITTCC, to 51555. That's PITTCC to 51555, and someone will be back to you within 2 business days. Now we'd like to introduce our guests on today's show. Meet Dr. Thomas Gould. He's the Vice President of Academic Affairs at Pitt Community College. And Donna Neal. She's the Dean for the Health Sciences Division at the college. Guests, welcome. We're so glad you're here.
Thank you.
Dr. Gould and Donna. First, we want to talk a little bit about the college. Dr. Gould, tell people that are watching that may not be that familiar with Pitt Community College about what we do and who we are.
Absolutely. So Pitt Community College is an amazing place. We are the 6th largest community college of the 58 in North Carolina. We have over 11,000 curriculum students enrolled at PCC and over 10,000 continuing education students enrolled at PCC.
Wow.
We offer 80 programs of study, everything you could possibly imagine, and also we give 280 credentials. So last year we had over 1,800 graduates at PCC. So whatever you are looking for at Pitt Community College, whether from high school equivalency to high-tech, high-demand training, we have it at PCC. And now is the perfect time to be a student. Business and industry, they're looking for workers. They need trained, skilled individuals. Individuals can get those skills, that training at Pitt Community College. Now's the perfect time to change a job for a career.
Wow. Well, that's terrific. And Dr. Gould, I think it's interesting. We talked in the intro a little bit about the fact that, you know, we have people from all walks of life that enroll in PCC. And we're going to talk about that during today's show with some examples of people that were doing some jobs and started other things. But tell us, what's the average student age at the college?
26 years old.
26.
We have students from 16 to 60.
Wow.
Across the board. Again, whatever an individual is looking for, whether it is just to skill up, get some additional training, get some short-term skills to go right back into the workforce, we have that through continuing education. We have trade classes. We have CDL starting with the trucking industry.
Commercial driver's license.
Absolutely.
Yes. With
the trucking industry. So we have Project Skill Up, where you can get oral solid dose training to work in our pharmaceutical services partners. PCC has a great relationship with our business and industry stakeholders in Pitt County and all over eastern North Carolina, and they all tell us they are looking for workers. So whatever your age is, it doesn't matter.
It doesn't matter.
We have a place for you at Pitt Community College.
Let's introduce Donna Neal. She's the Dean of the Health Sciences Division. And health sciences has to do with things like nursing and radiation therapy. And we have some great guests from your division coming on. Let's tell people some of the classes and programs and things that people would study under health sciences.
Okay, well, Pitt Community College's Health Sciences Division offers training in 19 healthcare disciplines.
Wow, 19.
And so we do have programs such as nursing, occupational therapy assistant, medical assisting, health information technology, and so forth. We have several associate degrees that we offer students. We often divide our programs into 2 categories. About half of our programs we consider to be entry-level programs, meaning students coming right out of high school can prepare. Students who don't have healthcare backgrounds can prepare for these programs and enroll in these programs and earn associate degrees. The other half of our programs are what we consider to be advanced practice programs or specialty programs, where they're training program opportunities for people who are already healthcare providers that want to come back and get some additional credentials to add to what they have, and that helps them be more marketable in the workplace.
Well, and we're going to meet some instructors with your program a little later in the program. Just great stories and great opportunities and great paying jobs.
Absolutely great paying jobs.
And we were talking a little bit before the show, particularly people identify with nurses and those things. You know, Pitt Community College has students that have trained with them in nursing at bigger hospitals than anybody might think.
Sure.
At Duke.
Right. Pitt Community College has one of the largest nursing programs in our state.
Yes.
In fact, this coming fall semester we'll be growing our nursing program and accepting 50 more students than what we normally accept. So we'll be up to a capacity of 275.
Oh my gosh.
And we do have students from our nursing and all of our allied health programs that go to work in places actually all across the country, but certainly across the state of North Carolina. So they go to work in big regional trauma centers like Vidant, Wake Medical Center, Duke University Medical Center, and so forth. But then we also have a lot of graduates that go to work in doctors' offices and urgent care centers and imaging facilities and cancer centers and so forth. So we have students placed in a variety of different kinds of healthcare settings.
Well, and great paying jobs for people looking for careers. And Dr. Gould, what did you say about careers? It's time to
change your job for a career. And if you are unsure, we have a marvelous career services area that will help you decide what you want to do, how you're going to get there, what your academic plan is, how you're going to pay for it.
Wow.
If you're unsure, we will go through career assessment, career exploration. We want to make sure that every individual is the perfect fit in the perfect career.
Well, you want to stay tuned because it only gets better. We'll be back after a few messages, but remember, anytime during the show, if you have a question, you'd like more information about one of the programs or something that we've talked about, all you need to do is to text the words, the letters, Pitt, P-I-T-T-C-C, Pitt CC to 51555. And we'll be back right after this. Welcome back to Education on Call, and we've had a new guest join us, Elaine Spencer. She's the program director for the Radiation Therapy Program, and we're anxious to hear all about that. And staying with us is the Dean of the Health Sciences Division, Donna Neal. Thank you, ladies, for being here. And we want to hear all about these programs. Some things came up in the commercials that just played we want to talk about too. Talked about stackable credentials, and that's very important with this section of the college. And the other thing is the hospital simulation lab, and we'll get to that in a second too. But Elaine, first, tell us about the radiation therapy program. What do you train people to do?
Okay, in radiation therapy, we train students to use ionizing radiation to treat cancer patients.
Okay. So, a very important job.
Yes.
And so tell us about the program. How long do you study in your program?
Okay, our program is what we consider an advanced degree for radiographers. So the radiation therapy program is a one-year diploma program. Students coming into that program have to be ARRT certified in radiography before they enter our program.
Wow. And people that graduate from your program, what kind of jobs do they go into? Cancer centers?
Yes, they can work in hospital cancer centers as well as freestanding cancer centers. They can also become application specialists that go around and actually train other folks to work on the linear accelerators.
So for people watching, whether it's someone that maybe already is in a health science job of some type or others, what are the credentials? What are people, what kind of training do they have that get into this type of work?
Okay, most of the folks that come into the radiation therapy field are already radiologic technologists.
Okay.
So they actually work in imaging departments.
And they're good in science.
Yes, they're good in science, good in math.
Yeah.
Good with people.
Yes.
Very good people skills and very good patient care skills.
And, you know, the times that we do go to medical facilities and see people, I always ask people where they went to school, and just 8 out of 10 times they'll say they had taken classes at PCC. So you have a lot of graduates out there, and you've got great facilities to train people in. If they haven't had an opportunity to visit the campus, it's state-of-the-art opportunities to learn these skills. Where do your graduates go to work at?
Our graduates actually work in North Carolina, South Carolina, Virginia.
All over.
Those are the main states because we actually have clinic sites in all those states. But, you know, all over the country. But any cancer center that you visit in Eastern North Carolina, as well as across the state, you'll come across Pitt Community College graduates.
Wow. And if someone wanted to know more about your program, they could contact you.
Yes, they could contact me at the community college.
And as we've said, you know, if anytime during the program you would like to speak with any of our guests, with Donna or with Elaine, all you have to do is text PITT-CC, PITT-CC to 51555. That's PITT-CC to 51555, and someone will be back to you within 2 business days. And I would encourage people to come and take a tour. You guys have great facilities to show people. And in fact, in the commercial that aired just before Elaine, you joined us, it had a commercial with Dr. Mary Robb in the hospital simulation lab. That is a state-of-the-art facility. Donna, tell us about that.
Well, we're very excited about our new simulation hospital.
Yeah.
It's been something we've wanted to do for a number of years. We've been performing simulation in our training for a long time, but we were doing it in the program's dedicated areas, and there just wasn't a way to really truly recreate that hospital environment. And so in January, we opened a new 10-bed simulation hospital. We renovated that space over the past year before we opened it, and we have 10 human simulators in that setting. And so basically what we've done is recreated a hospital environment for our students to come and train in. The great thing about this, well, really 2 things. One, it gives the students an opportunity to practice, and if they make a mistake, be able to learn from that. But the other big advantage for our students is it gives us an opportunity to bring all of our different disciplines together, and for students to be able to learn from each other and practice with each other just like they would in a hospital environment. And the other, one other huge advantage for us in terms of our facilities is that it is a clinical placement for some of our programs. And so I had mentioned earlier that we'll be expanding our nursing program and having our new simulation hospital, and that being able to be a clinical placement for students in our nursing program is one of the ways we were enabled to do that.
Let's go back to what you said. We were talking about this earlier. The human simulator.
Yes.
Now, when I was visiting the other day, I became a little concerned because I saw human simulators blinking. And
yes, you did.
Tell us, they do everything real patients do.
Well, I joke with the students as they're learning to use them, and with our faculty, that they're only lacking a conscience, and aside from that, they would be real. And I remember my first experiences with it. So yes, these human simulators pretty much we can make them do all the things that a patient would do. They have heart sounds and heart rhythms, and they can speak, and they have all sorts of sounds students can listen to with their stethoscopes, and we can assign them different scenarios, and the students can play those scenarios out with these simulators. And the simulators are also recording what the students are doing with them. So if they check a pulse, then we know that they checked a pulse. And so the nice thing about the simulation hospital is they're working with these simulators. They get to be videotaped and recorded so that we can play those experiences back for the students, and the students can critique themselves and critique each other. And we call that our debriefing in simulation. And so we are really excited about the opportunity that's providing.
That is a wonderful facility right there in Greenville for people to be able to study. And the other thing that can happen is that while the students are working unencumbered by the instructors are in the other room watching. They can see what's going on.
Exactly. They are in a control room. And
Yeah.
you mentioned that people can come by for a tour of our facilities.
Yes.
We have people coming through to tour that simulation hospital all the time. And in fact, we conduct many tours while the students are in there practicing, because in a hospital environment, students would be interrupted by visitors and people coming into the hospital. So we truly are trying to make that simulation hospital as realistic to the hospital environment as we can make it.
Elaine Spencer, I had asked you earlier about the qualifications for people that get in the radiation therapy program. You have a great story that you shared with me. We've talked about students come from all walks of life at Pitt Community College. The average age of a student there is 26 years old. Tell us about the police officer that showed up.
Okay,
One
yeah,
day. You probably wondered what was going on.
I was kind of scared. A police officer showed up at my office one morning,
Yeah.
dressed in uniform, and he had told me he had been on the force for about 13 years, and he was looking for a career change.
Wow.
Had a family, a young family to take care of, and was looking for something that would allow him to spend a little bit more time with his family and a little less stress. And so we got talking, and he found out that he first needed to complete a degree in radiography before he could come in the radiation therapy program. So we talked about it, and he said, well, that's what I want to do. And 2 years later, the gentleman let me know that he was ready to apply to my program. He had worked full-time and part-time while putting himself through school and taking care of his family. Came in my program, completed the year in radiation therapy, again, while continuing to work on the weekends in law enforcement. And he graduated, and within 7 months, he became a lead therapist, a lead radiation therapist. And now I'm very proud to say that he is a manager of a major cancer center, or a major radiation oncology center at a cancer center in North Carolina.
What a success story.
Yes.
Wow. Well, our students do come from all walks of life, and we're so very proud of what happens, and the facilities are wonderful. Elaine, thank you so much for being with us. And Donna, you're going to stay with us, and our next guest is going to talk about emergency medical science. We're going to find out what that is. If at any time during the program you'd like more information, would like to speak with our guests, come take a tour of the health science facility. It's wonderful. Please do that. Text PITT CC to 51555, and we'll be right back. You're watching Education on Call. Welcome back to Education on Call, and guys, we've got a great program. It's about the Health Sciences Division and training careers at Pitt Community College. Let me introduce the gentleman that's just joined us. It's Craig Carico, and he's a Level 2 instructor in emergency medical science, and we will tell you all about that. Also with us is the Division Dean, Donna Neal. Thank you for being here, and we've got some great information to share. One thing I want to start with is that I think it's interesting, both of you actually are PCC attendees. You are alumni. You both went to PCC. In fact, Donna, you were telling me there were like 3 buildings when you were going there.
The PCC campus has changed a lot since I was a student. I was a student here in the late 80s, and there were like 3 or 4 buildings and a couple of modular units on the campus. And now, to look at our campus, it has grown so much. It almost looks like a small university.
It certainly does. State of the art, and you do want to come. Craig, we want you to tell people what is emergency medical science, and what do people study? What do you teach people?
So emergency medical science, in layman's terms, you teach someone how to be a paramedic.
Okay.
They get an associate's degree that goes along with it, but we break down the curriculum. They'll study pharmacology, cardiology, advanced airway management. They'll also have a clinical component that they go to at the hospital. So each semester they'll go to that. Before they start the paramedic program, for someone coming in, you'd have to know the difference between an EMT and a paramedic. So an EMT is the first level, and then you would move up to advanced life support, becoming a paramedic. But our first, in the fall, they'll take the EMS 110 class, which is what you would take to receive your EMT certification, or basic life support, in layman's terms.
Yeah.
Again. They would take that in the fall, finish it, and then they can take their state exam at that point. And we encourage students to take it early. Usually they'll take it, this last group that went through, they took it the day after or the week after the class ended. And then once they got certified, we helped them get jobs. They got out in the field, and so they're seeing real calls as they work. And while they're in school, they can put that together. They're putting what they learned together from the classroom to the call, because they're working with paramedics. So what better way to learn how to be a paramedic than to work with one?
Well, I tell you, that's terrific, and we do need to mention that throughout the Health Sciences Division and other classes and divisions at Pitt Community College, we have great relationships with industries, in this case hospitals, and teams that do what you do, not only to tailor our programs to train people to go right to work with those facilities, but a lot of those groups donate equipment, and they want your graduates. They want them very badly. I want you to talk to us about the ambulance simulation. I may not be saying that right, but you have a simulation situation that most places don't have, that people train within.
We have been super blessed. We have an ambulance simulator. So if you take the back box of the ambulance and were to put it in a classroom, that's what it looks like.
Wow.
So I worked on an ambulance as a paramedic. I went from being an EMT to a paramedic like everyone else. Mm-hmm. I did that for 12 years. Wow. And so when I get and sit in the back, it's almost, I get that real ambulance feel from it. Mm-hmm. And it's nice to be able to pass that on to the students. So you can have, we have mannequins that are simulators. So we have medium fidelity mannequins and high fidelity simulator mannequins that we'll put in the back, and the students can treat them outside of the ambulance. They pull the stretcher out, treat the mannequin, load him up onto the stretcher, and package the patient. And then once they're done packaging the patient, they put him into the ambulance, and they can flip the lights on when it's an emergency call. Wow. Which is really nice. When I went through my training, we didn't have anything near as nice as what we have there now. And it's amazing how far the program has progressed. And the students, the reaction from the students, just seeing the look on their faces, it makes it all worthwhile. And they've really, when they get in the back and they're still working on the patient, because we act like we're riding to the hospital, and they'll make a call into the hospital. And the plans are in the works. So this summer we've got a time set up where they'll run the call, and then we'll move over to our simulation hospital and work with nursing students, respiratory therapy students, and a plethora of other students.
What a great facility to train in. Craig, where do your students come from? What walks of life decide that they want to get in the EMT business?
So, really all over the board. If you were looking at age groups, there's nothing to really peg it down.
Yeah.
We have students that are 18 years old. I've had some graduate that are in their late 40s, and one that just graduated that was in his early 50s.
Really?
Yes. So anybody can become an EMT paramedic from all walks of life, and really the more diverse your student population is, the better, because you're representing your community.
Yes.
So you want it to be very diverse in the workplace.
It's men, it's women, it's all over. And all ages. That's really great. For people out there watching that want to know more about this program, would it be appropriate for them to contact you?
Absolutely, absolutely. I'm very talkative, so Mama said I could talk to a stop sign sometimes. Okay. So I'll be glad for a student to come in and call me. I'm very personal with all my students.
Well, if I was interested, I would want to come and see your simulation ambulance. And if any time during the program you'd like to set up an appointment to meet and talk with Craig or with Donna, all you need to do is to text PITT-CC, PITT-CC to 51555. PITT-CC to 51555. Craig, you told me a great story about a student you had. You know, sometimes while we're in the middle of our training, life happens. And that happened to one of your students. Tell us about that.
So she came from Ohio, and I remember talking to her when we admitted her into the program, and she was excited about taking the paramedic courses. They had to go through the EMT course first. Yeah. About halfway, very bright student, she came in about halfway through the semester, and she told me that her and her significant other, they had decided to have a baby. And that they would, they gave me the due date, and it fell in between the end of the spring semester and the start of the summer semester. So we made a plan just in case. Yeah. Things came up early, and so we had her get her clinicals done early and everything. And then, of course, baby came along, beautiful baby girl. it was very nice, and I got to see her grow up a little bit throughout the program, the little girl too. But she came back during the summer and got right back to class, and only about a week and a half after she'd had the baby, she came back, right back ready to go, and she finished up. She got her certification as an EMT and got her working in the field. She became a paramedic, and she's been working out in the field now for almost 2 years.
Wow.
And she came back to me because I had told her when she was a student that we teach instructional methodology as well. So she was very promising. So I told her if she wanted to come back in a couple of years when she had some experience under her belt, she could possibly work for us and help train students, because that's what she had said she really wanted to do. So the 2 years came up, and she called me and she said, "It's time."
Wow.
So I said that'd be great, and we tried her out this semester. She's done well.
She's
with
teaching.
the students. She's precepting with the students and helping. Yes. So and we're going to use her more this summer, and we'll see where we go from there. But it's just she's really done well in her career, and she wants to advance herself further. So she's doing wonderful.
If you're watching and you're interested in the programs we've talked about today, please get a hold of Donna or of Craig or of Elaine, who was on with us earlier. We have run out of time. Text Pitt CC to 51555, and please join us for another edition of Education on Call.